Welcome to Academics in Nutshell. Today's session is Leptospirosis, what a pediatrician should know. The first thing that we should understand is that the concept of high-risk group has been nullified. Leptospirosis is also a disease of city dwellers, mainly due to the recreational activities like swimming, canoeing, surfing, and also widespread waterlogging in the streets during monsoon. The various ways that a human may be affected by leptospirosis are through the skin. Even through insignificant cuts and abrasions of the skin, the leptospira may enter. That's what may happen when somebody wades through the waterlogged street. And of course, the mucous membrane, like the mouth, the nose, the eyes, even the intact mucous membranes. And then other inhalation by droplets of urine or water also. Classically, the disease has a biphasic pattern of presentation. The first phase is the septicemic phase and the second is the immune phase. Now, in the septicemic phase, which lasts for about 3 to 7 days, there is high rise of temperature along with myalgia, headache, abdominal pain, vomiting, conjunctival suffusion typically, and at this point of time, the leptospira is detected in the blood, later in the CSF and in the urine also. There may be a brief phase of well-being, following which the second phase or the immune phase starts, which is mainly due to the endothelial damage caused by the leptospira. And this phase may last for days to months also. And here the presentation may be with meningitis, uveitis, rash, but fever is usually less. So when should clinicians consider the diagnosis of leptospirosis? Abrupt onset of fever with conjunctival suffusion and muscle tenderness, which is most notable in calf and lumbar region. The supportive investigations are not much conclusive. There may be slight lymphopenia, thrombocytopenia, and slight elevation of liver enzymes. But the classical icteric leptospirosis or Weil's disease is not common in children. The commonly performed tests are the macroscopic slide agglutination test, for which kits are commercially available, and the IgM ELISA. Now, IgM positivity is an indication of current or recent infection, but positive serology is always not a full proof of current infection, as the antibodies may persist for long years. So a fourfold rise in titer is diagnostic proof. Fortunately, leptospira is sensitive to most of the common antibiotics like amoxicillin in 50 mg per kg, indicated for 7 days orally. As an alternative, we can use azithromycin, cefixime, and also doxycycline. If the child is sick, requires admission, then intravenous ceftriaxone is a good drug of choice. Thank you. See you again in this platform.